My name is Staff Sergeant Allen. I'm a healthcare sergeant currently assigned to 2nd Battalion, 377 Parachute Field Artillery Regiment. Today, with the help of my platoon, I'm going to cover all steps necessary to conduct a blood transfusion with the Chinook Field Blood Transfusion Kit. According to TC3 guidelines, fluid resuscitation of choice for hemorrhagic shock is whole blood. Yet, 68 whiskeys Army-wide are still only trained to use colloids such as Hextend. Non-commissioned officers and battalion surgeons, I challenge you to ensure that your medics know this procedure, which could ultimately save somebody's life. This is everything that comes with the Chinook kit. The only thing that needs to be added is one 500 milliliter bag of normal saline. If you already have a walking blood bank set up, you can add pre-screened labels with barcodes to the DD Form 572 and the blood draw tubes to ensure accuracy for lab testing. Before the blood transfusion process can begin, the donor must be pre-screened. The walking blood bank will ensure donor's blood is clean and free of diseases. Once the donor has filled out the DD Form 572, ensure the donor is in good health and obtain a set of vitals before you start drawing blood. The next step is blood typing. Once both the patient and the donor's blood type have been matched, draw blood from the donor with all 5 blood tubes to be sent to the lab for further testing. You can also use the purple tube for blood typing. The next step is drawing blood. Ensure the collection bag is lower than the donor's heart during the blood draw. Clean the arm and apply a constricting band. Insert the needle into the donor's arm and secure it into the arm. Allow the bag to fill to 450 cc's, which should take about 10 minutes. Ensure the bag is gently agitated every few minutes to help mix the blood with anticoagulant. Measure the circumference of the bag with a 10-inch piece of 550 cord to ensure the bag is filled to 450 cc's. Not enough blood can cause citrate poisoning, and too much blood can cause clotting. Once the bag is full, clamp the line off, close the bag with the hemostats to prevent air from entering the line. Note that the clamping would be done differently in a clinical setting. Remove the needle from the arm and recover the needle. Blood should be transfused immediately. Whole blood should be destroyed after 24 hours. Ensure the bag is properly marked after the blood has been drawn. Next, you will administer a saline lock to the patient, preferably with a 16-gauge catheter. Once the white tubing has been inspected and all clamps are in the closed position, spike the normal saline. Open the clamp on the normal saline side to cover the filter with saline to prevent the blood from clotting. Ensure you bleed the infusion line with normal saline before you spike the blood bag to ensure there are no air bubbles, and then close the clamps. Spike the whole blood and hang both bags together. Check the patient's vitals and then immediately administer the whole blood and normal saline by releasing all 3 clamps. Blood fluid warmers are highly recommended. Continue to monitor the patient's vital signs throughout the whole process. Immediately stop the blood transfusion if there are any reactions and treat accordingly. Ensure all blood bags, blood tubes, and the DD Form 572 are properly documented and transported with the patient. Please ensure you have read the Chinook filled blood transfusion kit instructions before using this product. In a recent study conducted in Afghanistan, pre-hospital transfusions were associated with greater 24-hour and 30-day survival rates than delayed transfusions or no transfusions at all. Although the next echelon of care is usually minutes away in current deployment settings, the operational environment could change at any time. Combat medics must be educated in prolonged field care and be prepared to sit on a patient more than a couple of minutes.